Hi everyone. Thank you for joining us today. My name is Nam and I am here with my group partners Harjot and Kiana. We are excited to present to you our findings on the KINEON Move Plus Pro, a device designed to treat pain and inflammation using LED and infrared light therapy. The KINEON Move Plus Pro, or the KINEON for short, LED and laser is a product designed to treat pain and inflammation by emitting light frequencies into the area. It contains 8 LED lights at 660 nanometers and 10 infrared laser diodes at 808 nanometers. This product claims to trigger your body's release of nitric oxide to dilate blood vessels and stimulate the energy output of mitochondria. They claim this product can reduce pain by 80% in 4 weeks.
How KINEON works is that KINEON uses a combination of LED and infrared lights to combat muscle fatigue, muscle recovery, and pain reduction. LED and infrared lights target the body in many ways, such as stimulating nitric oxide release and also stimulating the mitochondria. When nitric oxide is released within the body, it results in vasodilation. Vasodilation is when blood vessels within the body start to widen, allowing for more blood flow to certain areas. When the mitochondria of a cell is exposed to these different wavelengths of light, they're also stimulated to increase their production of ATP. ATP is used within the body as an energy source, which allows our cells and muscles to perform any type. The outcomes of these different wavelengths on cells and muscles result in significant pain reduction, improved blood flow, and enhanced tissue recovery. Infrared and LED light therapy enhances mitochondrial function, which is critical for cellular energy production. When light photons are absorbed by cytochrome C oxidase, which is an enzyme within cells, it leads to increased production of ATP. Elevated ATP levels improve cellular metabolism and repair processes, which help with reducing inflammation and pain. These therapies can also decrease the production of pro inflammatory cytokines and increase anti inflammatory cytokines. Infrared light, in particular, helps to increase blood circulation in the applied area by stimulating the release of nitric oxide. Improved blood flow brings more oxygen and nutrients to tissues, promoting healing and pain reduction. These certain wavelengths also stimulate fibroblast and collagen production, which aid in the repair and regeneration of tissues. Together, all these benefits that LED and infrared light have come together to overcome many problems within our body that derive from using our bodies daily. LED therapy utilizes blue, near infrared, and red lights to provide a variety of benefits for the human body. These include activating mitochondria, reducing oxidative stress, stimulating collagen production, and offering anti inflammatory effects. The primary target of LED therapy is the mitochondria within all cells. Mitochondria are membrane bound organelles that reside in the cytoplasm of eukaryotic cells. They are frequently referred to as the powerhouses of the cell because their major job is to produce adenosine triphosphate, which is also the cell's basic energy currency. When the cells absorb this LED light, particularly near wavelengths of around 600 to 1000 nanometers, it targets an enzyme known as cytochrome C oxidase. Cytochrome C oxidase, also known as complex IV, is a key enzyme in the mitochondrial electron transport chain, which plays an important role in cellular respiration and energy production. When this enzyme is affected by the LED light, it causes more ATP to be present within the cell, which ultimately leads to enhanced cell function and increased cellular energy. LED light treatment can also assist in lowering oxidative stress in cells. It achieves this by increasing the levels of antioxidant enzymes that neutralize reactive oxygen species, which is also known as ROS. By lowering ROS levels within the body, cells suffer less oxidative damage, which is especially helpful to cellular health and longevity. The increased ATP synthesis and decreased oxidative stress offer an ideal environment for cellular repair and growth. This is especially crucial for wound healing, tissue regeneration, and overall skin health. Infrared light penetrates deeper into the skin, closer to 700 to 1200 nanometers, which has different effects on the body compared to LED therapy. These benefits include deep tissue penetration, pain relief, and enhanced blood circulation. Since infrared light can penetrate deeper into the skin, it has access to muscles and tissues that are not accessible by using LED therapy. Another benefit of infrared light therapy is that it can promote vasodilation. Vasodilation is a widening of blood vessels which allows for more blood flow to certain areas. When circulation is improved, it brings more oxygen and blood to tissues, which helps muscles and tissues recover rapidly. Endorphins are the body's natural painkillers. When infrared therapy is applied, endorphins are produced at a higher rate, reducing inflammation and relieving pain. Since LED and infrared light have different wavelengths, they each have separate benefits, but together both infrared therapy and LED therapy help the body's muscles and tissues recover more efficiently.
KINEON uses 3 people on a scientific review board to promote the validity in its claims. They have 2 physiotherapists and a chiropractic doctor. Marco Vandersteen is an advanced sports therapist. He has also held the title of head of medical, physiotherapist, and performance manager for various soccer teams. His schooling information is not easily accessible. Evan Piken is an integrated physiologist. He has a bachelor's degree in interdisciplinary biology from Stony Brook University, a master's degree in medical physiology and pharmacology from the University of Florida College of Medicine, and a graduate certificate in applied data science. He created another startup which developed a wearable device for measuring muscle oxygenation and nitric oxide levels in small blood vessels. Dr. Luke Stringer has a doctorate in chiropractic medicine from Palmer College and a bachelor in sports science. Dr. Stringer owns a chiropractic clinic that offers K laser therapy, which involves 5 to 10-minute therapeutic treatments with 660, 970, 905, and 800 nanometer light frequencies to help with inflammation and pain reduction. KINEON also promotes its products vigorously through testimonials and sport influencers. On their webpage, they include an area for influencers to sign up to partner with them to further promotion of the product. Most of their affiliate partners are CrossFit athletes, but they also have partnerships with sports podcasts, physical therapists, and other types of athletes. They very deliberately use an appeal to authority to gain trust from potential buyers. They use an abundance of promoters and regular buyer testimonials to prove efficacy of their product, yet they do not provide studies based solely on their products.
KINEON claims over 6,000 studies have been conducted on the efficacy of LED and laser treatment for pain and inflammation. However, they only provide 6 articles, none of which studies the efficacy of the KINEON Move Plus Pro itself. 2 of the provided studies are not open to the public and require purchase of the papers. One of the studies also heavily promotes the KINEON Move Plus Pro in a model-based dosimetry study. However, the study does not use the KINEON. Only a model of the diodes and LED lights placement on artificial knee models with simplified tissue layering. Of the studies conducted, only one of them speaks to the efficacy of 600 nanometer light frequency. The goal of the study was to determine the healing properties of LED lights and the frequencies on the sciatica nerve. A section of the nerve was surgically cut and placed in a silicone tubing. It was treated with 660 nanometers of light for 1 hour a day. They then tested the area for nerve growth and conducted an antioxidant assay. The study then found that the nerve generation was promoted and antioxidation didn't begin to decrease until 7 days. They determined that LED frequencies of 660 nanometers promoted antioxidant which may induce nerve regeneration. However, the study was not open to the public and we cannot speak on the validity of method, subject pool, or data collected. Of the studies conducted for the 800 to 1000 nanometer range, which is of the laser diodes used in the KINEON Move Plus Pro, a randomized control trial was provided testing efficacy on pain relief and range of motion for 40 participants with naproxen injections for rescue treatment. A pre-experimental non-controlled trial was also conducted for pain reduction in upper back and shoulders with 26 participants and meta-analysis review of low-level laser therapy for chronic lower back pain with or without rescue treatment, which include only randomized control trials and a total of 394 participants across all of the studies. In each of the papers, efficacy and pain reduction was reported to be significant across all trials. However, there is no significance in most of the trials for an increased range motion of disability scores, which measured pain during use of the affected areas. Within the meta-analysis, they also discovered efficacy for chronic pain was greater in studies that coupled light therapy with physical exercise.
Overall, the underlying claims of this product have solid scientific basis in pain reduction, as we can see from the many studies regarding efficacy of light therapy. However, we cannot conclude that this product is delivering results on all of its claims. Based on the studies conducted, range of motion is not increased, disability pain is not decreased, and only chronic pain is decreased through treatment. There are no reference studies done specifically for the product, and the recommended dosages, which are 15-minute intervals, are pulled from an average of both the low light studies with a full 1 hour treatment time, along with the laser diode studies, which are 30-second treatments. This company relies too heavily on its appeal to authority to prove efficacy of the product, and it would benefit from conducting its own studies. We believe that at-home treatment does not utilize sufficient research on the product offering, and therefore do not believe this product can claim efficacy under the recommended dosages.